Welcome to Joy in Our Town. I'm your host today, Kate McGovern, and today's guest is Patricia Miller. Hi, Patricia. Welcome to the show.
Thank you, Kate. Thank you for having me.
Yes, and you are the director for the Center for Behavioral Health.
I am.
Yes, and we're going to be talking today about the opiate addiction. And so, Patricia, tell us a little bit about that. What is the opiate addiction?
Well, as a way to introduce the Center for Behavioral Health, and then I'll tell you about our local Quad City opiate addiction issue.
Great.
Center for Behavioral Health was actually founded 32 years ago. It's a family-owned business, and we have a presence in 8 different states and over 20 different centers. Each center is run with the most extreme level of professionalism and clinical integrity that the states and federal government require us to have. Here in the Quad City area, we've been in Davenport since April of 2014. So we're still fledgling in this area, but as an organization, we're very, very mature and very progressive and in tune with the addiction and treatment of. So your question was about opiate addiction.
Yes.
It's an interesting epidemic in our nation today because the highest percentage of opiate addiction right now stems from prescription medication that has gotten out of control for the patient who was legitimately prescribed an opiate to treat pain, and for a lot of different medical reasons we may get into later, it led to a dependence, which in turn led to an addiction. But then there's also the other flip side to opiate addiction, which is heroin. And heroin is very prevalent in the Quad City area. It's been here for a very, very long time. Treatment modality is the same, whether it starts with prescription medications or heroin. The way we approach the treatment is the same.
So we're talking about this starts as a prescription.
Oftentimes. The CDC just put out a report June of last year, and they indicate over 82% in our nation of opiate addictions stems from prescription medication.
Can you tell us a little bit about the scope of that here in our own community, that the addiction to opiate?
Well, I can tell you that in 2014, the County of Rock Island had a minimum of 9 deaths determined to be strictly heroin related. Now, those are the overdoses that led to a fatality. Those are not the overdoses that are treated every single day in our local emergency departments by paramedics that arrive on the scene or by any first responder. The overdose happens on a weekly basis, both in Scott County and Rock Island County. It's quite prolific. Keeps all of our first responders very busy.
Explain a little bit, Patricia, about this addiction and what is the big issue about this?
You know, it's different than a lot of other addictions because for people that are not addicted, they might look at their family member or their loved one who has an addiction and say, why can't you just stop? Why can't you just put me before that drug? And that's a fair question for the non-addicted person to ask. But for the person who's addicted, their brain, the actual structure of the brain, the physiology and how the brain functions changes with prolonged opiate use. And so for a person who's been on opiate, whether it's abusing a prescription medication or heroin, for them to simply stop, they lose all sense of normalcy, meaning they become physically sick, the pain goes down to their very bone, they can't find peace, they can't find rest, they can't sleep, they have uncontrolled sweats, body aches, they lose control of a lot of bodily functions in the withdrawal process from the opiate drug. So it's a very painful, very prolonged withdrawal process. And if you haven't fixed the problems that led to the addiction in the first place, simply going through withdrawal from the drug isn't enough.
Now, is prescription drugs the only way that this addiction actually starts?
No. I actually interviewed my very first patient last week that said, well, you know, I'm a heroin addict, and I just tried heroin one day because I saw a friend using it, and I thought, yeah, I want to know what that's like. That is the first person in over 20 years in behavioral health who's ever simply said, I went straight to heroin. Most people with that addiction start off with more less provocative drugs, maybe marijuana, maybe alcohol, and then they increase the level of their substances until they finally try heroin.
Okay. So, Patricia, tell me, how do you identify the issues to this? You know, what is it that you see?
Are you asking what leads a patient to us, or?
Yeah, what leads a patient to you?
Typically, it'll be because their life has spiraled out of control. Maybe they've lost a job. Maybe they've lost their third or fourth job. Maybe they lost a marriage or custody of their children or experienced an arrest. Because oftentimes, opiate addiction or any other drug addiction leads to some type of criminal behavior because they have to support the addiction, because oftentimes they have lost their means of income by losing their job. So they turn to other more nefarious ways of getting the money to buy the drugs to maintain their addiction. So any number of things can lead a patient to us, including a patient who simply one day wakes up and realizes, I can't keep stealing my mother's pain medicine, she needs it for herself. Many different things bring them to us.
When they come to you, how long does a treatment actually last at the center? I mean, how long is that process for those that come in?
Okay, that's a two-pronged answer. We are evidence-based in all of our clinical practices, and all the data indicates that the longer a person is in medication maintenance treatment, which is what we do, medication maintenance treatment, the longer they're in it, the longer period of time of sobriety following the treatment episode that they will experience. So evidence-based practices say 12 months minimum on a stable dose of medication along with cognitive therapies is what will help that person be successful. So in that first year, while the person becomes stabilized on the medication so they can have a sense of normalcy, so they can stop all the behaviors that put their community and their health and their families at risk, a lot of life change takes place in those first 12 months. And then at the end of those 12 months, they've reached a base of stability, and then we have a conversation whereby, based on federal regulations, we reassess the patient's need as to if they clinically need to continue, but then it's also patient-driven. So we would say for example, Kate, do you feel that you're in a safe place socially, with your family, with your employment, with your residence, are all the places in your life a safe place where you're not going to find yourself triggered or spiraling back into addiction? Or you feel like you're in a good place? And if the patient says, no, I don't have everything in place, I'm not ready to be without treatment, and if we find medical necessity, we would continue on to reassess another 12 months later. But it's patient-driven. At any time when a patient says, I am ready to try life without treatment, and then we would do a structured, what's called a medically supervised withdrawal from the medication. We would taper back on the counseling, supportive services, kind of like letting that bird fly from the nest and see how far they can soar. And if they ever feel uncomfortable and feel the need to come back and re-engage, we're there for that re-engagement. Our hope is to help people overcome the addiction, to employ, to have a family, to have a stable residence, and be successful contributing members of our communities. That's the end game for us. It takes a lot of work to get there.
Yes. Oh, fantastic. And how do you actually treat the addiction?
Good. Well, we start with a thorough 3-hour assessment for a patient when they walk into our center and say, I think I need this treatment. We will do an assessment by a medical director, physician, nursing staff, as well as counselors. 3-hour assessment determines if they're good, appropriate admissions. Then once admitted, they will begin a medication regimen, and they take the medication every day. We start with a very low dose, and as the patient's tolerance and symptoms indicate, we may increase that dose to a stable dose. Meanwhile, they'll meet with their counselor every week, and we'll talk about how do you identify what triggers your use. We'll develop that relapse prevention plan. We'll help them develop community-based resources so they have more than just that weekly counseling touch. We help them with marriage and family, helping family members understand what is addiction and how to help the person who found themselves in addiction rather than nag them into a relapse. It's a fine line between support, accountability, versus nagging. So a lot of work happens.
Yes, it sounds like it. And your programs, how do they impact those that are really struggling? What do you see?
You know, we have folks that initially might be living in a shelter, and we help them get stable with their addiction. We help them get connected with, if they need mental health services, we connect them with mental health services or any other medical or resource allocations to help them stabilize their behaviors, stabilize their health, be able to work, and eventually move into an apartment. We help to connect them to all those resources. We will partner with other people, such as the community health centers in the Quad Cities, by doing resource fairs in our clinic. And patients can come in and learn, where do you get a good outfit for free to interview for that job that they want? How do you get your teeth fixed so you can present nicely for the employer? You know, all those resources, health, be checked for hepatitis, or the Scott County, Rock Island County health departments do free testing for communicable diseases. Whenever you're using intravenous drugs such as heroin, high risk for communicable diseases. So we make those resources available to our patients so they can medically be checked out and get the right care they need so they can be physically as well as mentally stable and healthy.
Wow, sounds like a beautiful program that you have going, Patricia. Tell me a little bit about a testimony that comes to mind for you right now that you'd like to share with our viewers here real quick.
You know, we have a woman, she's in her 60s, lived much of her life in Texas, moved to the Quad Cities, fell into addiction, severe addiction for a very long time, lost her husband. When she walked into our center 6 months ago, she didn't have stable anything. And she has now not used any illicit drugs since her admission into the program. She's fully engaged in the counseling services. She got a job for the first time in 20 years. She has saved money and is now ready to buy her first own car. It's very exciting.
Fantastic, very exciting.
Yes, and most people in their 60s think, what's left for me? And here she has a whole world open up to her because she had the courage to ask for help.
Well, Patricia, I just want to thank you so much for sharing today and the courage, like you said, to come in. It does take courage to want to have change. So thank you so much for being with us today.
Thank you, Kate.
And I want to thank you, viewers. Thank you for being with us today. We'll see you soon.
More than 600 people are living with HIV and AIDS in the Quad Cities.
Over 150 of them don't know it.
The project of the Quad Cities provides support to hundreds of individuals and their families in Iowa and Illinois.
We've performed thousands of confidential HIV tests and helped HIV-positive mothers give birth to 18 HIV-negative babies.
Our mission, your life, the project of the Quad Cities, committed to action in the battle against HIV, STI, AIDS.
Welcome to Joy in Our Town. I'm your host, Lori Pierce. Today we're welcoming Leslie Mussman, who is the Director of the Area Substance Abuse Council. Leslie, welcome to our show.
Thanks for having me.
You're welcome. I see you brought some guests with you today. Would you like to introduce them?
Sure. We have Sue Wolliver here. She's our coordinator from the Hightower Place in Clinton. And we have Gabe Gluba, who is the King House coordinator in Clinton as well.
Well, great. Well, welcome. I'm glad to have all of you here today. So today we're going to be talking about working for a drug-free community. But before we get started on that, would you guys like to maybe tell a little bit about what you do with the organization?
Sure. I have worked in the prevention area for the last 15 years with the Area Substance Abuse Council. I'm the director for the prevention agency for Clinton and Jackson County. And what we do is we work with youth and with the community to work on community substance abuse issues and try to prevent those issues in young adults and adults.
Okay. And I know, Susan, you work with Hightower Place, is that correct?
That's correct.
And what do you do there? I'm
the program manager there. We've been open since 2001, and we work with women with substance abuse issues, with alcohol and drug problems. They are able to bring their children there, and we offer them treatment and support to help them gain sobriety and independence to reach out to and live independently in the community.
Wow. So they live there plus get help while they're living there?
Absolutely, yes.
Oh, wonderful.
Yeah.
And Gabe, I know that you work, is it King's?
It's the King House.
The King House.
So I'm the manager of the King House, which is ASAC's male substance abuse halfway house facility. It dates back to 1966, where it was founded by Dr. Ross King in the Clinton community, who was a physician who was very active in recovery. So we house 8 to 9 males that live there, help them on their sobriety and transition into back in the community.
Is there an age that a man could come there for help?
Usually starts at 18, but we've had gentlemen as old as 65 there also, so a wide spectrum of ages.
Okay, great. Well, whoever would like to add, but what are some of the signs of substance abuse? Whoever would like to answer that.
Sure. So when you're looking at somebody who has a substance abuse issue, you're usually seeing changes in personality is a huge one. If they may have absentee issues from school or from work, you might see some sporadic behaviors of either being awake a lot or maybe being sleepy that would make it out of the ordinary for you. They might start hiding things from you, or you might catch them in lies or in secrets that you wouldn't normally see in them. You can also see issues of changes in their friends and who they spend time with. You can see changes in how they relate to others, how they relate to their family. You might see some depression issues or anger issues. So those are big key elements of what you can see when you're looking at a substance abuse issue.
Sure. And that probably ranges whether you're talking about a teenager or someone older too.
Sure. Yep. Teenagers is a little harder to see because those are teenage behaviors in general.
Yep.
So we hear a lot from families and parents. What are some real things that I can look for? And what we recommend for parents who are working with youth is to make sure that you know their friends, make sure you're understanding what's happening on their social media, make sure that you are aware what's happening in their bedrooms, and just keep your eyes open for things that look out of the ordinary.
Sure. Are there any trends that you see locally happening with substance abuse?
Yeah, we see a lot of substance issues that have been in our area for a long time. Alcohol, marijuana, those are issues that we see a lot. What we have seen is that a younger age of people are using those substances. So where before we might say high school would be the area that we would see first use, we're seeing use at middle school ages now. We're also seeing that there's not a lot of education out there, and parents really struggle with understanding the new drugs. Even though marijuana has been around for a long time, a lot of families and communities don't understand the changes in marijuana, the potency of the new marijuana, and the way that youth can use marijuana now in oil or in what we call dabbing or like a crystallized form. So those are new trends. We also see a trend with prescription drug abuse, especially painkillers, in the adults especially, that might be prescribed by a doctor for perfectly fine use, but an addiction comes from that, or an overuse of a painkiller to deal with maybe stress or some family issues. Sure. And we're seeing that turn into something that's new for the Midwest, which is a heroin epidemic or heroin issue. So that's new for us in the Midwest.
Yeah. So when you're talking, kind of going back first to the kids, when you're talking about the kids, do you guys go into the schools and do any kind of preventative there at the schools?
Yes. So prevention in general, we try to see youth at the universal or all youth as at risk for something. It's just a risky time of their life. Mm-hmm. So we try to provide life skills to youth, and we do that through school-based programming. We provide that either during the school day as part of the curriculum, or we can offer it in after-school kind of settings, depending on the community and what they have available.
Yeah. And I thought I read somewhere as far as prescription drugs when they expire. Do you guys have some kind of a program to help dispose of those properly so they don't maybe get in the wrong hands?
Absolutely. So in Clinton County, we have what are called prescription drop boxes at all of our law enforcement agencies. So the Sheriff's Department in Clinton, then also at the Clinton Police Department, DeWitt Police Department, and then the Comanche Police Department. They all have boxes available where you can bring any prescriptions. So that includes narcotics that you can take back and you can dispose of, getting them out of your home, getting them out of harm's way.
Yeah, something maybe a lot of us don't even think about, but
Right.
a great program to have.
Yep.
So what issues do you see in the community when you're dealing with substance abuse?
Well, for us, our community issues really come down to how do we help the community protect people while still making sure that people have the right to do things and live their lives freely. And so we spend a lot of our time working with community coalitions, bringing together different sectors of communities to discuss these issues, to come up with strategies that will work for everybody. So especially around issues of alcohol, tobacco, legalized substances that sometimes can be a little bit more difficult for people to just dispose of altogether. And so we try to help communities come up with positive ways and supported ways in the communities to keep people safe.
Yeah. So how do you go about addressing and identifying the issues?
We go through a pretty extensive community assessment process. There's what's called the Iowa Youth Survey, which is done for youth in 6th, 8th, and 11th grades every 2 years, and that's put on by the Iowa Department of Public Health. We use that data. It's localized, so we can use our county data and see what trends are happening with youth, not just in substance abuse, but in mental health and a lot of other areas as well. We also do community looking at our treatment numbers, looking at our law enforcement numbers, just looking to see what the overall issues are.
Okay. And let's say someone has a problem. What are the steps that they would go through? They would contact you, and then what would be the next step?
Sure. I'll let Sue and Gabe talk a little bit about our treatment program and how to go through that.
Thank you.
Well, the first step that they do is they contact our office, which is New Directions, ASAC in Clinton, Iowa, and they obtain an evaluation. And then through that evaluation process, they determine the level of care that is needed for that individual, and then they make the proper referral or recommendation. So that's basically how it gets started.
Sure. And would that be the same for you also?
Yes, it would, but we also offer crisis services at no charge. So if a individual or a family member needed education or questions or just help, they could first just call our office, get that information over the phone, or drop in and somebody would meet with them and provide them some general information to get the ball rolling.
Okay. Well, let's say a family member or a friend sees that there's a problem. Can they take the necessary steps, or does it have to be the person who's dealing with the issue? Do they have to come directly to you?
Well, the family member or friend could contact us and we could help them through that process as far as trying to help the individual that they're concerned about come voluntarily. Also, at times, if that person wouldn't come voluntarily and there's a concern, they could go down to the courthouse and get a committal filed, where that would mean the person would have to come and at least do the assessment so we could see if services are needed or not.
Okay, that's good to know. So if you had to kind of pinpoint maybe some things that the area substance abuse council, how it benefits the community, do you have any ideas on that you could share with us?
I think the big thing to know is that we provide a large gamut of services all the way from prevention, so prior to use being an issue, through recovery and how people can get into recovery and then live a life of free from substances. So we, beyond our halfway housing, we also have outpatient treatment. We can refer for detox to the Quad Cities, has detox available so people can go through that process, and then they can come back to us and get the treatment that they need. The Area Substance Abuse Council has availability for adult and youth services for in-house, so people can get clean in a safe environment where they can get round-the-clock treatment and then be able to come back into the community for outpatient services.
I had seen too, are these places smoke-free? Or
Yeah,
not
all of our programs are smoke-free.
Okay. I did see you guys also kind of help homeowners come on a list that they're smoke-free, which I think is wonderful because it gives people that option. And when you're struggling, you don't want to probably go in to an environment, where you're having that.
Yeah, definitely. And honestly, they say it's a relapse trigger as well. Smoking cigarettes and is a big relapse trigger, and that's why a lot of treatment programs are going to the tobacco-free campuses. So other than we're trying to maintain health in our community, and that's, you know, a big part of maintaining health is being tobacco-free and substance-free and trying to be, you know, a positive member of our community and helping our children and our families stay together.
Right.
You know, so.
Yeah. So whether someone's looking for treatment or prevention, where could viewers go for more information?
They could look at our website. It would be www.asac, that'd be asac.us, and that would explain all the services that we offer in the 5 counties, a description, contact information to get to the best person in each program or county. Mm-hmm. One thing we talked about assessments earlier.
Yeah.
In Clinton, our New Direction office, we offer walk-in assessments on Wednesdays, 1 to 3. So what that means is walk-in, first come, first serve. Sometimes we find that appointments are scheduled so far out it takes a while to get set up with services. So that's another avenue to utilize.
Yeah. Great. That's good to know. So do you guys have any testimonies that any of you would like to share?
Well, within the last 6 months, I've ran into about 3 individuals from King House who's had 18 months plus sobriety, which is awesome. Can think of a lot of guys that went through or currently in community college or employment, but one that sticks out to my mind is last year when I was at the local trunk or treat in Clinton, Iowa, handing out candy to the local children. I saw a former client with his 2 younger sons in the wheelbarrow going through getting the candy line. So in my mind is this person prior to that, if he was actively using, didn't have any involvement with his children. Now he's there in a family-centered activity, spending quality time with his kid. So that really hit home to me as far as a success story.
Absolutely.
I've worked at Hightower Place since 2001, so I've seen honestly several success stories, but one of them that continues to come to mind is, you know, I'm active in my community as well, and I have grandchildren in the community, so I go to activities in the community, and I also was at a ball game and saw a resident that had completed our program quite a few years ago with her son, and he was playing baseball as well, and she was letting me know how well she was doing and was very happy doing very fun, positive activities in our community. Yeah. So.
Well, Leslie, Susan, and Gabe, thank you guys so much for coming in and sharing some great information with us on kind of substance abuse prevention and treatment.
Thank you.
Thank you.
And thank you so much for tuning in. We'll see you next time on Joy in Our Town.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telephone dollars. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.